Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Stream Team, welcome to another episode of Balls Deep. I am Dr. Joe Pazona, your host, and this week I'm a little scared, but I've got Kat Williams here with me.
I'm here, but you're in the hot seat today.
Yes, we had such a good response to our previous Ask Me Anything episode, and so we're doing it again.
Oh, yeah, we're doing it again, and it's going to get a little more personal today. So that's going to be fun.
Oh, boy. Well,
Yeah.
I appreciate Tom B., one of our stream team members, for making these suggestions. After the last time we did this, I wanted to make sure these were legitimate questions. And if y'all haven't watched that last AMA episode, it's a hoot. Please do. And I'm still not convinced
Those were legitimate questions that were sent in. I did not make those up. Those were legitimate.
All right.
As are these.
All right.
As are these. So let's do it.
I digress.
Okay. Time to do it.
Here we go.
Time to go.
Balls Deep.
Okay. Number one. What was the craziest request that you've ever had from a patient?
Wow. This
Craziest.
is craziest request. So I'm going to take this question in a direction. Let me go with it. And I think you'll see how it was
Okay.
a bit of a request. So years ago, I saw this guy who stated that he thought he had put something inside of his urethra.
Oh, God.
And, you know, for the urologist in the room, this is one of those things that wake us up in the middle of the night and we're like, oh, I wonder what I'm going to find. You know, this is like, you know, you hate to be woken up in the middle of the night, but, you know, when someone has either intentionally or unintentionally had something inserted in their urethra.
I think it's always intentionally, isn't it?
Yeah.
Okay.
You're like, oh, okay, I wonder what I'm going to find here. This is going to be a really good story. So this guy came in and he saw me during like the business hours. So it wasn't middle of the night. And he said, yeah, you know, I think I put something in there because I'm having all these symptoms. Can you take a look inside with a scope? And so his request was for me to put a tube inside of his urethra or inside his penis. And I said, well, if you think you put something in there, it's probably a good idea we look. And so we...
But again, he just thinks, he's not
Yeah.
sure.
Yeah. So we take him back to our little procedure room, and we typically do these procedures under local anesthesia, so the guys are fully awake for it. And we give him some lidocaine jelly, put it in the scope, take a look. And mind you, this also was like an add-on to my day. I mean, I already had a really busy clinic, waiting, you know, trying to get home to my family. And listen, we take our patients and patients come first, but we definitely went out of our way to take care of this guy on this day, and it was pretty busy. So I take a look in, and I'm like, I don't see anything. And I took a look around the bladder, and I'm looking, and I look up at him, and I'm like, dude, are you sure you put something in here? He goes, yeah, maybe I didn't.
What?
And I looked at him, I said, what? How do you not know whether you put something inside your pee hole? I mean, there's very few times I show anger, and I bet if you had a camera on me that day, the look on my face would have been one of disappointment and anger, to say the least. But kept it professional and took the scope out, and I said, well, the good news is you don't have anything in there. I wish you the best of luck. And we were done. So I still, you know, was the dude high when he was concerned about this?
Yikes.
Was there some weird, like, other things that went through my mind? Was like a weird fetish thing? Like, I don't know. All I know is, usually when I tell patients I've got to put a tube inside their pee hole, they're running to the other side and I've got to tell them why it's important. This was one of the few times it was a request, and unexpectedly found nothing. So
Nothing.
nothing.
Well, that's weird.
Yeah.
That's just a weird story that kind of came to naught.
Well, welcome to urology.
Okay.
It's kind of people go, why do you look at penises all day? I'm like,
It's
I've,
a good question also.
I've got great stories, you know. And again, just to be clear, very respectful of all people who come in the door. We're not going to use any identifiable patient factors
Oh.
with these stories because, you know, certainly the privacy police are out there. But, you know, this is more of a way to let people in behind the scenes of what life of a urologist is like. So,
Well, in continuing with that theme, question number 2. So, of the 20 years you've spent as a urologist and a practicing surgeon, what is the most, can you think of the most complex or rewarding or difficult, even the most difficult surgery that you've ever had? What comes to mind?
yeah, this I'll try and fill in the details. This was a gentleman I saw several years ago, and I think he might have even came through the ER. He was having some abdominal pain, and I was on call and came to see him and was billed as he's got kidney tumors in both kidneys. And I went and talked to him and examined him. He had a mass that was so big coming from his kidney, his abdomen was pooching out. And just to understand how big of a tumor that means he had, the kidneys sit in our back.
Oh,
So
wow.
in front are all of our intestines, our abdominal wall. I mean, the kidneys are not like right here when you press on your belly. I mean, they're in the back. And so I looked at his x-ray and he had a 30 centimeter tumor of one kidney. And then on his other kidney had about a 5 centimeter tumor.
Hmm.
And this gentleman did not come from means. He did not have the resources. I mean, he essentially was kind of by himself. If I recall correctly, he had some child or two was in the picture, but wasn't married. And really
Didn't
was
have a
just
support system.
didn't have a support system, was scared, didn't have options. You know, I was it for this guy. Like, this was not a guy I was going to be able to, you know, fly down to MD Anderson or Memorial Sloan Kettering to get surgery. Like, I was his guy and his only hope. And so we worked him up and quickly took him to surgery. What we first did was send him to the radiologist. When you have tumors that big, all the anatomy is really abnormal and distorted. And you can imagine how big the blood vessels are going to those tumors to get that big. And so I sent him to a radiology colleague to kind of plug up the blood vessels to the kidney ahead of time. So we lowered the risk of bleeding during surgery. And I mean, we made an incision from one rib all the way across his belly to the other. My partner and I from residency, Jeff, and it was a several hour surgery, but it went great. I mean, and this tumor, when it came out, I mean, was about this big. It was massive.
It's bigger than a basketball.
It was incredible. And you know, it was one of those moments where, you know, here I was, you know, 10 plus years into my career, and I'm like, this is pretty cool. You know, this is like the fact that I saw this guy from a history and a physical exam diagnose this tumor to the complexity of it. The fact that he had this on both, not only that, he had another one on the other kidney. We did this giant surgery on him. He did great. And then about 6 weeks later, after we proved that that one was cancer, we had to get the other one out as well because that was likely cancerous. So I then took him for a second surgery, and now he only has one kidney. So I've got to save that one remaining kidney, get this large tumor, pretty low. I mean, 5 centimeters is a good sized tumor on a kidney. I mean, 30 is obscene. And so the stakes for that one were arguably even higher because if he loses that kidney, he's on lifelong dialysis. Mm-hmm. And for those who aren't aware, when you're on dialysis, your 5-year survival rate is 50%.
It's not great.
I mean, it's as bad as a cancer diagnosis. So we did what's called a partial nephrectomy, where we just remove the tumor, save the kidney. We've got to temporarily stop the blood supply of that kidney. So again, very high stakes here. And again, just, the good Lord was on our side and his side, and he did great. And so he ended up cancer free, off of dialysis. And here I was, just a kind of a small town urologist, doing this stuff, not at some big fancy cancer center. And it was complex, it was rewarding, it was challenging, it was all of the above in one case. And I mean, every time I saw that guy thereafter, we just hugged each other. I mean, um, it was a pretty cool moment. I no longer do big surgeries, but I mean, even thinking about it, I'm getting a little emotional about it, because it's a really a privilege to do what we do. And we laugh a lot and we complain a lot, but in the end, I feel very, very lucky, to help a guy like that. And so, kudos to the great mentors I've had, and the training to be able to do that. And that was definitely a highlight of my career, to be able to help that gentleman out.
That's a pretty great story. I don't think I've ever heard you tell that
Yeah.
one specifically.
Yeah.
That's one of the good stories. Well, bring it back around. Tell us, that was obviously a patient who was very compliant and very interested in recovery.
Mm-hmm.
I know that every once in a while I hear you talk about patients who are not so compliant. Give us a story about maybe your most non-compliant patient, if you can think of one.
This one is a doozy for sure.
Okay. Hold on to your hats, everybody.
This is on the other end of the spectrum. So we'll go from a little bit of tears to some laughter and shock. This gentleman was country, to say the least. And I say that for all the good and such associated with being country. So this gentleman had been working with some battery acid in his barn, his shed, kind of, out outside his house, and had to go to the restroom. And so he forgot that he was using and touching and working on battery acid. So when he pulled his pants down and touched his penis to pull back the foreskin, needless to say, it hurt.
Wow.
And he thought that the best thing to do in that moment, after screaming, was to go, what were his words? Dip it in the crick.
Dip it in the crick.
So he put his penis in the running dirty water out back by his house. So now he has shocked the skin with freezing water of unclear cleanliness. And so he showed up in the emergency room. I got called to see him. And so not only did he have this battery acid burn of the skin of his penis, the entire head was swollen, because when you pull the foreskin back on some men, if you don't put it back over the head, it kind of constricts the blood flow to and from the head. And so it really swells up. And there's not really an elegant way to treat that, other than you've got to squeeze the swelling and the extra fluid out of the penis until it gets back down to a normal enough size and pull it over. That's painful enough. It's really painful when you have a battery acid burn. Mm. So we ultimately took this guy to the operating room. We got everything reduced, put back. I put on a bandage and did what we could, and got him back to his room. Saw him a little bit later after he woke from anesthesia. I was like, all right, man, here's the deal. I've got a bandage on there. Do not touch it. Just leave it the way it is. I know it's uncomfortable, but we've got to let this area heal. Please don't touch it. And please, for God's sake, whatever you do, don't dip your penis in water again.
Fairly straightforward instructions.
In under 24 hours, I got a phone call from the nurse that he ripped off the bandage and put his penis in the cup of ice water that was by his bed. I cannot make this up if I tried.
No.
We
No.
don't need the Netflix roast of Tom Brady. We need more urology stories out there because this stuff, again, I can't make up. He ultimately, from what I remember, he either left the hospital against medical advice or left and never followed up. So
Oh no.
I hope this poor gentleman is okay. I hope he wears gloves and takes them off when he uses the battery acid again. Well, I think he used the gloves. The problem was he forgot to take them off. So, um, uh, daily public service announcement: please don't touch battery acid then your penis, and please don't go dipping your hurt penis in ice water. It's just not good for it. So.
Words to live by. Wow. I really didn't know that this episode was going to descend into this kind of madness.
Yes.
But I mean, let's just keep going. I've got a few more minutes here. Okay, what about the scariest moment of your life as a physician?
Oh,
Do you have one?
you know, I think as a physician, to a degree, if you're honest, you live in constant fear. I mean, I hate to say that, and I'm not a doomsday guy. I'm not a high anxiety guy. Um, but I don't think people understand that. And I asked for it. I'm not complaining by any means, but I think it would go a long way if people understood the constant stress and pressure us physicians are on, the constant fear of being sued and how scary that is. I mean, this is our livelihood, and people can, willy-nilly bring up lawsuits that are completely frivolous, and they still go pretty far in the system. You're like, oh, frivolous ones get thrown out. No, they don't always. We can be reported by different agencies. There's that sort of fear that I think is constantly there. You hear stories of angry patients going in and shooting up doctors' offices, and as someone who deals with some angry men on testosterone or low testosterone or cancer diagnoses and may not have the support system and coping mechanism, there's always that thought of, am I ever going to walk in a room and, be attacked or hurt? And then as a surgeon, I mean, we have people's lives in our hands on a daily basis, especially when you're doing big surgeries. And I think every surgeon has had a situation where you've had a patient who's bleeding quite a bit in front of you, or God forbid has a cardiac event or something. And that's frightening to think that even if you didn't directly do something that led to that person's situation, you were the last doctor that they saw. And so, these are always the scary sort of moments that we live by, and they're all equally scary for different reasons. But I still love what I do. It's still worth it all in the end. We have a great privilege and a great responsibility, and with that comes these things that we gotta cope with. And if I'll hand it to my colleagues. Y'all are some of the most resilient, toughest people I know, because you don't get through medical school and training if you're not. There's no wuss doctors out there. If you are a doctor, you have been through it, and everyone's got their war stories. And oh, it was tougher when I went through. But bottom line is, you still have those pressures on a daily basis.
If you weren't a urologist, what kind of physician would you be?
Ooh, that is a good one. God, part of me would love to be either a dermatologist or a plastic surgeon, because I think they have the benefit of operating outside of the broken healthcare system. They don't have to worry about insurance quite as much, prior authorizations, worrying about medications. I mean, you can kind of run these cash practices. And I say that not from the financial side of it, but more the headache side. Talk about some of the stresses we deal with as physicians. I mean, the amount of my time and business that's devoted to dealing with insurance companies, hospitals, vendors who just don't play ball, it's maddening. So I say that, but I don't know if I'd really enjoy it. I think right now where my real passion is in wellness and preventative medicine. So, in fact, that's probably where we're already doing it with Pazona MD. And I'm much more interested right now in learning how to prevent disease and longevity than I am learning, my 50th enlarged prostate surgery. So I'm still a urologist, still gonna learn and practice that, but I think there's a huge opportunity to get wellness and preventative medicine right, where we incorporate diet and exercise and all aspects of wellness, not just you have high blood pressure, here's your pill, sort of thing.
Okay, what kind of doctor would you never want to be?
Ooh, what would I never want to be? I don't know if I could be a foot doctor. I'm not, you
Oh,
see,
really?
yeah, feet are kind of gross. I don't know. I mean,
Not
it's,
everybody's feet. I've got great feet.
uh, you do, but yeah, I mean, you smell enough bad feet, and you're like, or look at enough toenails, you're like, oh God, So God bless all the podiatrists and foot and ankle guys out there. I don't know if I could do that. I don't think pathology is my cup of tea. You're really, you're dealing with tissue and specimens and not live human beings. So I don't know if I'd enjoy that aspect of things, for the same reason, maybe even radiology. Some radiology is hands-on care, but, sitting in dark rooms, reading x-rays, just again, I like kind of interacting with folks and being out there and,
But no feet.
yeah, I don't
Pass
think
on the feet.
Yeah, I think I'm going to pass on the feet.
Okay. Well, I think this is all great. I have one last question, and then we'll kind of wrap it up for today with you in the hot seat. And this is sort of a question I would truly like the answer to. Who would you cite as maybe the greatest influence in your life, and maybe the most charming, maybe the most delightful person in your life? Who would you cite kind of as the, your favorite influence in your life?
Is this a leading question, Your Honor?
Absolutely. Absolutely.
Well, on that note, I think we'll
Didn't answer the question,
we'll
though.
end today's episode. I'm very appreciative and love you very much.
Good answer.
So, listen, Stream Team, I hope you had fun today too. And
We'll put him back in the hot seat again soon. Send in more questions. The more inappropriate, the better.
please do. Listen, one of the main reasons we're doing this show is we want to have fun. Certainly now some of you may listen to us and go, you are making fun of people. I'm not making fun of anyone, and anyone who knows me knows that I treat all patients with respect, even ones who do less than recommended or intelligent things. I'll give a very
less than compliant.
Or less than compliant. I'll give a very PC answer. But I think it helps to look behind the scenes as to what life with a urologist is like.
It's interesting.
What the healthcare system looks like from our perspective. And obviously, too, we want to, share great nuggets of truth and I guess, stories of caution with y'all. So if there's any other questions you'd like us to answer, please leave them in the videos and send them on over. Kat, thank you for a fun time here today.
My pleasure.
And thank you, Stream Team. We're most appreciative to all of you. Please remember to show yourself a bit more kindness. We're all works in progress and opportunities for growth. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.